Up on that, but let's go to Quebec, where Premier Francois Legault is speaking. Let's listen in.
Refondation qui est nécessaire,
a new foundation that's necessary in the healthcare network to be able to increase hospital capacity. This refounding will be done in staff, people working in the healthcare system. Obviously, we'll need more people. For example, nurses. Training a nurse requires 3 to 5 years. So this needs to be kept in mind. We have to be realistic, yes. We've put incitements and scholarships for people studying in cégep at university. And I would like to take the opportunity to make a call to the young people and less young who haven't yet decided on a career. If they want to help the public, we need more people to take care of our people. It's a profession that is gratifying. It's rewarding, and there will be a lot of jobs in the coming years and decades. Go study nursing to consider it as a career. Yes, we need nurses, but there are other ways to improve the efficiency. They work very hard. The main challenge is around those working in a healthcare network. What that means is that beyond collective agreements and unions, what's important is to be able to validate the initiative and autonomy among individuals within the healthcare network. And this is what Christian and Sonia thought of when negotiating the last collective agreement. We gave ourselves a greater margin of maneuver to establish scheduling locally, decentralize, and incite people to fulfill those positions that are harder to fill and work on weekends, and to encourage more people to work full-time, because we can't have an efficient healthcare system with 40% of nurses as part-timers. And this should happen soon, is accelerated training for auxiliary nurses so that nurses can delegate certain activities, so that they can focus on the more principal tasks. So this is coming. There are people, thousands of people, who are in training right now. So this will help improve efficiency and capacity in our network. And we've been talking for a long time now. We have to work on this. Family doctors. We will never have an efficient healthcare system if we continue to have as many minor interventions, P4s, P5s, as they're known, NERs, instead of family clinics. So discussions are ongoing on that side as well. So there's a whole refounding to be done, and we need to be realistic. It will not happen overnight to increase the capacity. And as long as we can't increase the hospital capacity, we'll be limited for our ceiling. So we have to be cautious. So while, in the meantime, we need to be responsible. Us, the government, but also all citizens of Quebec. And I will come back to the numbers. Last week, we had about 3,400 COVID hospitalities, and last night we were at 3,278. So as you see, it's not going down quickly. So last night, Christian and I spent more than 2 hours with INSPQ experts and public health. And the experts tell us that there should be a slight decrease in hospitalization in the coming weeks, but the interval of the confidence interval is very broad. Will there be a strong decline? There's too much uncertainty at this time, and we have to remember too that we still have 12,000 workers absent from the healthcare network. So this is the situation before us. So we need to be responsible. I understand that we are all conscious that many Quebecers are fed up. They're fed up with the restrictions. It's been 22 months. I also understand that many Quebecers are starting to worry about their mental health. So we agreed with public health to announce today a few relaxation measures, but the idea is to go gradually, cautiously, and slowly, as in a Quebec expression, let's not go too quick. The word is mollo. We have to take it easy. So we have to start with small gatherings. So I announce, starting Monday, January 31st, it will be possible to gather in homes. 4 people, 2 bubbles. So 4 people from 4 different homes or 2 families from 2 different bubbles can get together. Restaurants, we decided the same thing. People who are used to meeting in restaurants instead of homes, so starting Monday, January 31st, dining rooms will open to 50% capacity, but people will be maximum 4 people or 2 bubbles with the vaccine passport, obviously. The other thing that we talked a lot about in recent weeks is what's happening in the retirement homes. Residents, the people who live in these homes, are entitled to 1 visitor. That's hard. It's for the seniors. So we agreed with public health that in CHSLDs it'll be a maximum of 2, but 1 at a time. And senior homes it'll be a maximum of 4, but 2 at a time. This is important to specify. But I also want to bring another specification. I'm addressing the owners of retirement homes. First, already, it's allowed in spaces to have 4 people eating at the same table. So 4 residents. Unfortunately, some residences where people don't leave their rooms. So we have to find a way. I understand that it's done with good intention. Owners want to be cautious. They don't want any infection and repeat what has already happened in the past, but we can't go to the other extreme. People in CHSLDs and senior residences need to see other people. I think it's important that they be able to eat at tables of 4. As we've seen earlier in restaurants. Now, the other thing, and where we'll make changes starting Monday, January 31, is sports for young people. Children have made a lot of sacrifices since the beginning of the pandemic, and it's important for children to play sports. So starting Monday, January 31, school sports and sports we call civil sports that are outdoor will also be allowed, maximum of 25 people. But we should mention that only for those under 18. And also, public health wants to say no competition. We can go on practices, but unfortunately, no competitions. And also, starting Monday, in chalets, cafeterias and ski chalets, like restaurants, could open to 50% capacity with the vaccine passport. And January 31, aquariums, botanic gardens, all these things will open at 50% capacity. And for the time being, the first phase of January 31, we are also announcing the second phase for Monday, February 7th. First thing that often comes back, culture. Quebecers are anxious to see their favorite artists. So first step, February 7, gives you a bit of predictability, is that cinemas, showrooms, hockey arenas will open to 50% capacity, maximum 500 people. So this is an effort being done on that side starting February 7th. The other activity that's important, we can't underestimate this for many Quebecers, is people going to worship. For many Quebecers, it's almost an essential service to go to Mass in a church on Sunday. So we will allow, starting February 7th, the reopening of worship centers to 50% capacity, maximum 250 people, which is about the same in churches, and always still with the vaccine passport, except for funerals and funeral homes. For humanitarian reasons, we will allow 50 people with no passport being mandatory. These easing measures we're announcing today stop here. I know the activities not mentioned, sports for adults, gyms, spas, but for the time being, public health tells us it will be coming in a third phase. The faster that we can have the certainty in these situations in hospitals, therefore capacity, will determine. I heard all kinds of people say, we'd like to have more predictability. We'd like to have a schedule or timeline for the coming weeks and months, for the entire ending of the restrictions. Well, us too. We would have loved to have a timeline. But at the same time, we have to be realistic. When we talk to the experts, there's a lot of uncertainty in the coming weeks. And we have to be responsible. And we have to be humble, too, because we've seen it for 22 months. There have been 5 waves, 5 increases, 5 decreases. Who would have predicted in December that we would have had a variant that would have brought us to the situation we've seen in the recent weeks? There's still a lot of uncertainty. So we have to accept that we need to adapt and be responsible. We need to make decisions to minimize deaths, obviously, but also respect the hospital capacity. If you want to help hospital staff, we'll repeat it. The most important thing to do is go get your first, second, and third dose. The minister explained to you yesterday that we'll go neighborhood by neighborhood to at least inform people who still haven't had their first dose. For those who are more vulnerable, such as 60 and older, please go get your third dose. We're at 95% first dose, 94% second dose, but 76% third dose. That has to go up. That 76% has to go up. Because the risk is greater when you haven't had the third dose. The risk is greater for hospitalization. So I conclude by saying that I understand that people are fed up, but at the same time, we need to be cautious. We need to think each day of the people, the frontline workers who've been working hard for a long time in our hospitals. So that's why we have to take it easy as we move forward. Thank you.